Welcome back. I'm Adriana Savral, reporting for the Ministry of Health and Social Development with my special two-part GIS report on coping with COVID-19. My guest is Dr. June Samuel, psychiatrist in the BVI Health Services Authority. We'll be discussing different coping mechanisms that persons can do and use during this time of the COVID-19 pandemic. How can persons, or what advice do you have? Like when I walk out of this building, now I'm seeing persons walking around in PPE that shouldn't be in PPE.
Right.
And that's gloves or face masks, and you can visibly see that they have the mask on wrong.
Yes.
I saw someone on a scooter with an N95 mask, or it looks like something that they use maybe to paint something.
Yeah, like a respirator.
At first it was funny, but then I started counting the number of people who are walking around visibly with gloves on. I'm like, does that really make sense?
Yeah.
How me, who I have nothing on, or at least I don't need it. Because, I mean, I know that PPE is used for either you're sick or you're a healthcare worker or, what's the third one? No, just those two for now that I can think of would be the real reason that you need it. Other than that,
yeah. So
why are you in the public? Why are you in the street walking around with gloves on?
And that is a part of person's anxiety and them trying to respond to make them more comfortable. That's to me, that's what
so I can walk up to them and say, take it off.
Well, you could, but they may not necessarily do that.
Right.
You know, persons who are wearing gloves and going from one thing to the next, they're more a danger than not having the gloves on and sanitizing. Because what's happening is, because you're wearing the gloves, you're thinking that, okay, yeah, I'm safe from anything. But everything you touch is still on the glove. And if you're not sanitizing, then you're infecting everything else that is around you that you touch with that glove.
Look into the camera and tell it for the people in the back.
Yeah, so why are you really wearing the gloves? What is it that you're trying to do? Okay? Soap and water works. Okay, if you touch a surface and you're concerned, go to the bathroom. Soap and water works all the time. The hand sanitizers work. There's studies out there that show that does work. Okay, but you have to do it regularly, consistently, and correctly all the time that you do it. Right? Wearing a mask, as you said, pointless. Wearing a mask. I've seen people wearing masks and the mask is around their neck. Why do you have the mask on?
It's a fashion statement.
I guess it is. Right?
I'm going to have to go start sewing some masks when I go home. But I don't want us to forget about these persons' questions that they have for you. So one person has said that they have been diagnosed with clinical depression. And as a means of coping, they socialize. So what are they to do now that they've been asked to social distance themselves and stay home?
Okay, so we're like at a different phase now. So initially, if I had gotten that question before we had the positive cases,
right, social
distancing does not mean that you isolate yourself from people, right? So social distancing is about maintaining an acceptable distance between persons. You could still go out. You could go out and eat, but you make sure you maintain the distance. Okay? You can go to the beach and have a walk, maintain the distance, right? So it doesn't mean that you can't socialize. It's about maintaining safe distances between each other. Now that we're in a different phase, so we're going into this lockdown period, where essentially we are all asked to be off the streets and maintain ourselves in safe spaces in our homes, right? That doesn't mean that you have to be isolated, okay? So get creative. We have technology, right? You can FaceTime, okay? You can WhatsApp video call, okay? You can do a simple phone call. You can do emails, right? But you have to make the commitment that, okay, I'm going to maintain contact, and you're going to be maintaining contact with who's your social circle,
right?
So your social circle can still be in touch electronically or via conference call. Most phones can do conference calling. You can actually have a group chat, right? On the iPad. You could Zoom call, right? So there are ways to be in touch and actually see each other if the visual is important to you, and still maintain contact. So we're techie people.
To a degree.
Yeah, well, we on social media, right? Use the technology available and get creative and stay in contact. And that's something that's, I think, important to stress as we go into the lockdown, because although the lockdown is initially for a week, it may be longer, we don't know. So remembering not to isolate yourself is important, especially for persons like who may live alone. Remember, we need to check on them, or they need to reach out and be in touch.
Okay. So one person said that they have a concern for security, and they saw officers today and they were doing some training, and they said with the robberies, and I guess with the loss of jobs too, their anxiety levels are up. But we said this before. They just need to turn it off. Oh, well, they were just passing by, so they saw the police training.
Right. So I think that is, another reason that person's anxieties will go up. So the basic needs have to be met adequately, right? Just from a psychological perspective. And our basic needs are food, shelter, and clothing. Shelter, clothing, food. So shelter is probably not an issue, although there may be some people who are still post-Irma, not
compromised.
Not in the best living situations. So those persons would have a high level of anxiety. And then food, we want to be sure that we have enough food. So that is why the Premier is always trying to speak to this issue of food and adequate supplies of food.
And the grocery stores said they got food, and people still,
Yeah. So that's coming from our basic desire to make sure that need is met. And then security, clothing, well, that wouldn't apply here. But security would be the other big need, and that's tied into like shelter, and just your general environs. So that would be something that the public would be concerned about. And I believe that is why, there would have been some discussions about, the police and how the police are going to be engaged, especially as, we go into curfew and all of these things.
We should be prepared to see officers out there.
So at home we need to
if you don't want to see it, go home.
Right,
Stay home.
Yes. And then if at home, we need to make sure that our own, that we're secure within our own space. So if we're in a space that, we're concerned about being safe in, you may want to consider alternative spaces. And how does that work for you as we go into a lockdown period, right? Be sure that wherever you're going to be is going to be safe.
Right. So the next question was ask how businesses will survive notorious curfew, and now don't leave your home, no stimulus package. Like, this person has a long list of stuff. They prefer, I don't even want to say this, but they're concerned about all the changes that's been happening. I think this person just needs to rewind what we've been saying about just cutting off a lot of the negativity.
Yeah. And I mean, okay, so, the concern is going to be, there's a concern generally about the effect that all of this is going to have on the economy. And that's going to affect all of us. All of us are going to be affected. I would have to trust that the government is looking seriously at that and would be making some decisions about, how we're going to support the economy. Is there going to be a stimulus package? How are we going to deal with persons who may be displaced from a work perspective? That's the function of government, and I would expect that at some point we're going to hear something about that. So for now, we have to just trust that, okay, that's coming in some future announcement, because I'm sure it is something that they would be paying attention to, right? But back to the choice, right? So there's like a risk versus a risk benefit analysis that would have been done.
Right.
Okay. Allow people to be out and about and let the virus spread like wildfire.
I mean, it's a somehow
versus shutting the economy, shutting the country down progressively. Yes, progressively it's been done. Okay, and then shut down to try to preserve as much life as possible. That's the risk benefit here. If you've been keeping up with the news, I don't have to tell you what happens with the inaction.
Right.
You just have to look at some of our neighbors.
Right.
Okay, and you see.
And we don't want that.
Okay, inaction will lead to, that's why the whole thing about it being a pandemic is not that people are going to die. It's a pandemic. It is going to stretch our resources. It's going to impact our resources very heavily. And that is why there needs to be you would see it as drastic approaches to deal with the situation, because you want to decrease the effect on your resources as much as possible. In the BVI, we don't have unlimited resources, and we don't have unlimited human capital either, right? So we have to make the decisions that would work in the best interest of the people in the long run. So it's difficult, it's a challenge, but the particular virus that we're speaking about, because of how it spreads, and we have everybody's experience, so it's not that we're making it up, we see it.
Yeah.
Right? And there are experiences out there that tell us how to do it correctly. And we're doing it correctly with
just
the
tweaking
countries.
It our way.
Right. The countries that have done it correctly have fared very well. There are countries in the world that have fared very well, that have had, small numbers of deaths. That's where we're trying to stay.
I think that's a good note to end on, right?
Yes.
So I want to thank you again, Dr. Samuel, for coming and speaking about mental health and coping, giving the public some tips, because it's just it's so many different elements.
There are a lot of different elements.
I mean, I feel, like the picture of the virus, all those little prongs, all those prongs,
yes.
it affects someone or some group in a different way.
So so before we go, if I just kind of wrap it all up.
Yes, tell us, in general.
In general terms, coping is still about looking after yourself well. So the analogy I use when I talk to groups is make sure that you're okay first.
And I like that.
Right? And then look out for your family, that's the people in your household, and then your community. So to make sure you're okay, you're doing all the things we ask you to do in terms of staying safe, washing your hands, etc. Don't touch your face, okay? Maintaining social distance. Make sure you're eating well.
Oh, yes. We didn't even talk much about building our immune systems.
Make sure you're eating well. So as anxious and upset as you may be, make sure you're eating regularly. You're eating good food, not processed food. Eating food that have colors, which is fruits, vegetables, and having a proper diet. So that's the first thing. Make sure you're sleeping well. So making sure
Let's tell our essential workers, make sure you all especially.
Yes, everybody needs to be
sleeping well.
Because one of the things when we get anxious and we're nervous and we're worried, it will disturb our sleep pattern. So make sure you pay attention to getting to bed on time, at a regular time, and getting up at a regular time. So even though we're going on lockdown for a week, don't sleep in all 12 hours. Maintain a structure still, because you want your body to continue to function in a way that is healthy, right? So sleeping well, good quality sleep, drink some, make sure you could have teas, chamomile tea, soursop bush tea. Those things help. Yeah, if you could find the soursop bush, it does help, right? So make sure you're sleeping well. Exercise. So although we are going on lockdown, if you have space in your yard, come outside with the kids, play, run around in the yard, play games, ride the bicycle, encourage your kids to ride. So you can come out in your immediate environs and still exercise and try to, get that movement going. So being on lockdown doesn't mean that you stay inside your house and don't come out into your yard.
Right.
You have yard space, okay, so you can come out and you can still move around. Exercise at home, do yoga, right? Do all, whatever. If you didn't have one before, start an exercise regimen now. It will help in terms of your overall mental health and helping you to keep calm. And then prayer, meditation does work, right? So doing something that keeps you centered. I talked earlier about the breathing exercises. You could do deep breathing. Deep breathing works because when we're anxious and we're nervous and we have a lot going on, we don't breathe well. We don't take deep breaths, right? So
I've been practicing a lot.
right. So
for sure.
very, very simply, if you're feeling anxious, stop. Just remember, stop, take some deep breaths, try to calm yourself, center yourself, and then move off, right? And I always recommend prayer and meditation because that's a way of keeping us focused and centered, okay? Keeping our thoughts in one place, trying to work with those negative thoughts, okay? So those are the things.
I just before we close out, there's one more question that I got. I didn't write it down, but this one in particular about persons who came back recently traveled.
Yes.
We put out a lot of messages like if you recently traveled, you need to self quarantine yourself, or self quarantine at home, and then or if you show any signs or symptoms, you need to call the medical hotline. And there's been maybe some persons feeling that there's a stigma, there will be a stigma attached to them if they call the hotline because they don't want anybody to write their name down that they've been tested. But if you can give any advice about that, so we could encourage persons who are at risk, persons who fit that criteria to just be tested, so that they do call and just get themselves checked out.
So, I mean, I guess the best way to deal with that is to say that there's going to come a time when with this virus, it's going to be almost like getting shots for your flu virus, right?
Okay.
We're waiting for the vaccine, okay? Getting tested and knowing is about understanding your own health status, right? Because you would want to, depending on who you're going to be in contact with,
right,
you would want to know if you're positive or negative because maybe you live with your mom who's elderly, right? Maybe you live with your grandmother who's elderly. Maybe you yourself have, multiple comorbidities, and you fall in the high risk group, okay? So when testing is opened up or offered, I think people should take the opportunity to get tested. It is not a death sentence,
right,
okay? As I said before, 80% of people with the virus are fine. I mean, and some people don't even have symptoms. So,
right.
So, some people...
I mean, I've asked to be tested.
Yeah.
Test me.
Right. So if that opportunity is made available to you, I think that you should go ahead and get tested. And you want to be ahead of the curve. So if you have medical conditions that put you at risk, you would want to know if you are COVID positive or negative because it may have implications for providing health care for you at some point in the future, right? So it's a part of managing your health and managing your health situation is the context that I would encourage people to put it into. Okay. The other thing is I will send to you the numbers that persons can call if they feel they just want to talk or they just want to vent or they're feeling real distressed because people showed up at my door today as a part, because contact tracing is going on.
Yes,
right.
So people
as a part of contact tracing, somebody may show up at your door to get you tested. And for some people, I know that causes a lot of distress. So, we're going to be putting out some numbers that persons can call if they just want to talk, just to vent and just to get a kind of intervention that helps them to keep things in perspective. So you circulate that as soon as I send it to you.
Yay. I was going to say, if you're going to say it right here, let me put that down. I can put it on the screen.
It's a lot of different numbers, so you're going to create a nice little flyer.
Yes.
Like you did for the hotline.
I have to. But thank you again. Yeah. I don't know how much we spent a good little while here chit-chatting about all these things, but I just think it's important that person think about the entire scope of things and not just, well, I don't have any job, I don't have any money, or whatever. But, you know, if you're exhibiting some other signs of anxiety or depression or maybe all those other symptoms like loss of sleep and you're eating and gaining weight or you're not eating and losing weight, you know, it's like it's the COVID diet. Like no one really wants that.
I mean, if you're having any of those symptoms and they're going on for longer than they should be, right? So you're gonna first do the preventative things to keep yourself well. But people who previously may have had anxiety, depression, or any mental health disorder, right? Or even some people with chronic conditions. So you may have a chronic painful condition. You may have diabetes and hypertension. And just the stress around this can aggravate those conditions, right? So you'd want to be paying attention. And if you think that you're really not coping, you either reach out to your practitioner or you call the numbers that we're going to circulate to get some advice about what you can do, because sometimes it's just doing simple things will set it back on the right path. So you have to look after yourself, and I can't stress that enough. Self-care during this time is very, very important, because if you're not caring for yourself and keeping yourself well, you can't keep your family well, and if you can't keep your family well, we can't keep our community well.
Right.
So that's how we need to see this.
Okay. I'm going to end there.
Okay.
Thank you again for joining me, Dr. Samuel.
You're welcome.
And you'll be back again, I'm very sure, after we come out of curfew.
Okay. All right.
That concludes the two-part special GIS report on coping with COVID-19. Again, I've been your host, Adriana Savarall, reporting for the Ministry of Health and Social Development. For more information on COVID-19, please visit www.bvi.gov.vg/COVID-19. And if you have recently traveled exhibiting any signs or symptoms such as shortness of breath, cough, fatigue, or fever, please take advantage and call the medical hotline at 852-7650. Until next time, thank you for tuning in.